Hello, my name is Collan Koeppen, DC from Active Rest, and I'm here today to go over information about the psoas muscle. The psoas, as we refer to it, P-S-O-A-S, is of course iliopsoas, as its proper name. The combination of two major muscles, the iliacus here, which is inside the hip, or the ilium, easy way to remember that. On the inside, and of course, the psoas major and minor here, which come collectively and attach to the inner thigh area in the front. Now, I don't want to be too technical here, but I do want to add that this attaches the low lumbar area to the upper leg, and it's a deep, powerful hip flexor. And when people have dysfunction here, for some reason, it's not always the case, but I find a lot of it on the right side. My theory is that it's due to driving, because the gas and the brake are both on the right side for people who drive. I'd love to find out in another culture if it's just as prevalent, where people maybe don't drive as much or some other thing like that. So if you have information, let us know, give us an email. But point is, what we see a lot is the psoas gets so tight, it actually pulls this hip forward. So if you have symptoms in the front of the hip, and it can be like an impingement, there can be a pinch of a nerve bundle, a neurovascular bundle that goes through. There's also a vein and an artery and other structures that go through here. So if you have a pinching feeling in the front of the hip, also, since it attaches to the lumbar spine here, when this gets tight and dysfunctional, it can actually pull the lumbar vertebrae over in one direction or another, or forward into the body. And what we find that when things move into the body, as opposed to moving backwards, when something moves forward, it runs into all the other structures inside your body. So when something moves forward, it hurts more and tends to have more symptoms involved in it. And what we do with the active release technique, here's the fix. You get in, you do the right pressure, direction, tension, and the right range of motion, and it mobilizes, it breaks the scar tissue and the tension in this area and allows the body to maintain its correction. So what I see is, let's say this sacrum and hip, the SI joint here, gets twisted forward to the right. We do the correction and move the hard structures back into place, takes the interference off of the nervous system so the body works correctly. But then we also have to take care of what I call the steel cable called the psoas, because some people are so tight it pulls. If you watch sprinters, athletes that are very developed in the psoas and the glute, they're related to each other, and you'll find they have excessive curvature in the low back, and that's another giveaway. Some people have both of them are tight, gymnasts and sprinters, etc. It varies by sport, but long story short, your center of gravity is here, and this is the keystone to the core musculature. And if you're having problems in the hips, low back, maybe you're getting adjusted and it's not staying where it should be, and it cracks a lot, that's also a good reason to look for the psoas. So anyway, hope you enjoyed this information. If you have any questions, please contact us. Thank you.